Hello, I'm Corporal Sean Benson, and welcome to On the Beat, brought to you by the men and women of the Baltimore County Police Department. This program brings you the latest information on public safety issues in our community and police department operations. In today's program, we will discuss drug abuse and awareness with Captain Matthew Gorman. Next, we will speak with Lieutenant Michael Steinbrenner about the Baltimore County Police Department's cadet program. And finally, we are looking for your help in solving the murder of a young father and former college athlete, 27-year-old Artis Holt Jr. Please enjoy the show.
On the beat. On the beat.
According to the State Department of Health, drug overdose deaths in Maryland have almost doubled in the years of 2015 to 2016. Since 2016, we have seen over 2,000 deaths each year as a result of drug overdoses in our state. The Baltimore County Police Department, the Baltimore County Department of Health, and the county administration are working hand in hand to combat this crisis. With us today is the commander of the Baltimore County Police Vice and Narcotics Unit, Captain Matthew Gorman, to discuss drug abuse in our community, what Baltimore County is doing, and how we all can help. Thank you for being on the show today, Captain Gorman.
You're welcome.
Appreciate it. And focusing on drug abuse in Baltimore County, what type of drugs have we seen being used in Baltimore County?
In Baltimore County, we see a wide variety of drugs being used. Everything from marijuana to cocaine. Heroin is a drug we see a lot in Baltimore County. And then some of the more rare drugs as well, mushrooms, carfentanil, those sort as well.
And then as far as drug overdoses that we've seen based on our calls of service, people calling 911 and the police actually responding, what are some of the areas that we've seen a concentration in our overdose deaths?
Well, really the overdose epidemic, it's hit the whole county. Certainly there's pockets that see more activity than others, but it crosses every socio and economic demographic that we have in the county. So it can't be said that just one area experiences this.
Right, so as a public, we all have to be aware of
something we all need
crisis.
to be aware of, right?
Okay, all right. And then can you talk about where we're seeing some of the sources of the drugs that are coming into Baltimore County? Anything substantial sticking out?
Well, it's not always known where it does come from. Certainly it changes hands many times. We're confident that some come from overseas. Some come from China, some from the South America venues, and then there's some drugs that are either grown or established right here in the United States.
Okay. And as the public, should we be aware of what drugs look like?
Yes, it's good to be aware and drug-wise, if you will, so that you might be able to understand when you or someone you know or love is perhaps involved in narcotics activity or addicted to drugs.
Okay. And we have some replicas here today. They're not real,
right.
But some of the things that we can go through to say to parents, like if you see this in your house, the alarm should be going off at that point. So we'll just go through what some of the things that we've brought today. Appears to be marijuana.
That's correct.
Okay.
Common packaging for civil amount of marijuana there, about 7 grams.
Okay, all right. And as far as the law in Maryland right now, if you have under this amount or about this amount, what would be the penalty?
Generally, it's a civil citation, and then the courts obviously would decide the ultimate sentence for it, but generally it's decriminalized from 10 grams and under.
Okay. And then these are some of the common packaging for marijuana
That's
also?
commonly how we see it, yes.
Okay, all right. And what would be like a common term for this type?
Oh, perhaps dime bag is a street term for that.
Okay, all right. And then the next thing, I'll do these two together. So if you're seeing needles and seeing a spoon as a parent, or have a child in your house, or see it on the street, laying on the street, call this in, and what is this indicating?
So we'll call that paraphernalia, but they are indicators of use of illegal narcotics, or at least legal narcotics that are used illegal, perhaps in some regard. So the syringe is used to inject liquid narcotics into one's body, and the spoon is oftentimes used as a tool for a platform for cooking or heating up the drug and forming it into a liquid to then be either inhaled or injected into the body.
Okay. So use some type of heating element,
like a lighter or a candle, right?
Mm-hmm. Okay. All right.
So if parents were to see those would be things that they might want to have some serious discussions with their children about.
Absolutely. And then these kind of look like vitamin capsules, but
right.
But what's the concern with
they're
these?
Not vitamins. Yeah.
Okay,
No, they're
yes.
That's representative of heroin, how we commonly see it. It normally comes in a capsule form like that, and a slightly off-white powder. And generally, we see that a lot in Baltimore County. Now, not everywhere in the country has a connection to heroin to the degree that we do, but that is something we commonly see. So empty capsules or even full capsules like that would be another thing that parents should be keyed in to see.
Okay, all right. And then this small glass tube, so if I saw a white powdery substance in there, what is this going to be an indication
of? So it could be a number of things, but those two vials there, they're pseudo-cocaine for our training purposes. These are training aids that I've brought with me today. But that's how we see that from time to time, too.
Okay. And is there a procedure as far as testing, not that the public would have access to, but that we have the ability to do?
Sure. So we have field test kits, and we also have, obviously, the laboratory that can give us the official test that's good for prosecution.
Okay. And then my fascination is with these small baggies. Really no other legal use for a bag this small.
It's hard to find a legitimate purpose for something that small, right? That's generally how we see crack cocaine packaged in a small baggie like that. Oftentimes, and I'm not sure if the camera can see, but there's markings on the bag, stamps, if you will, that oftentimes drug dealers will mark their product, so that it's kind of like their label or their brand, if you will, which can be helpful for us in investigations, but also it lets the consumer know whose product they have.
Okay, and they would be interested in one type of product over another one for purity reasons? Perhaps,
yeah. Or that they know where it has come from, or that they feel, I guess, a certain level of trust with someone.
So one type might be safer than another type?
Well, it often is. The narcotics that we're dealing with, the heroin, the cocaine, and I know the crack, and even the fentanyl that we'll get into in a minute, it normally doesn't come in a pure form. It's often cut with other agents or other powders and things, and so
you had mentioned that powders that may be mixed together. So what would this package be an indication of?
So that package is a replica of heroin, cocaine mixed with fentanyl.
Okay.
Just a white powder, very fine white powder.
Okay, all right. And the possibility of fentanyl being mixed in this, that could be a very small amount could be fatal, correct?
Right. That's correct. So we're generally levels of heroin or cocaine need a certain amount to be fatal to an average size adult human. Fentanyl the ratio is much less.
Okay.
And so it can easily be mismixed, or even the way it's incompletely mixed can cause the body to have a reaction to it, and instead of the intended high, it ends up becoming a fatal overdose.
Okay. And one of the things that we're seeing with the opioid epidemic that we're suffering from right now is that a lot of this addiction starts from possibly a sports injury.
It could.
Okay. Can you talk about some of that?
Sure.
It might be prescribed pain medicine for an injury, and that evolves.
Correct. So oftentimes we found, research has found that historically addictions to opioids have come through the prescription medication realm. So whether it's Oxycontin or Percocet or oxycodone, some common ones like that, for maybe even legitimate purposes, an injury like you indicated, or a surgery, or some sort of need that the person has. These substances are highly addictive, and so folks easily can become addicted to it, some even within the first several doses. And so obviously, listening to the medical practitioner, communicating effectively with them, and then taking only the minimal amounts, yes, and looking towards weaning yourself off of it as soon as possible, and then disposing of the whatever's left over in a timely manner, are all ways to keep oneself minimally exposed to it, yes, and then also protecting against the dangers of other people and being exposed either inadvertently or with a curiosity or even with an ill intent.
And you had mentioned disposable. So around the house, if I have prescription medication, opioids, any type of medication like that that's a narcotic, there's a way in Baltimore County for me to get rid of this stuff that's just laying around not being used, correct?
Yes, there's a safe way that you can dispose of it and it be out of your household and be out of the reach of young people or even adults. And that's at each of the precincts. Each of the 10 precincts within Baltimore County have a prescription drug box sitting outside of the precinct. It sits out front, and folks can come up and, without having to divulge their name or their identity or their address or anything like that, they can dispose of these drugs. And the drugs fall into the box and can't be retrieved until the officers from the precinct utilize our protocols to be able to take them out safely, and then they're disposed of in the right manner. So that's one way that the public can really keep themselves safe too, is unneeded, unwanted, found, perhaps elderly folks who have their caregivers who no longer need medication of some sort. All those sort of scenarios that those are acceptable receptacles for those drugs.
Okay. Thank you very much, Captain. I appreciate it. That was some great information.
Very good.
Thank you. If you want more information about substance abuse resources in Baltimore County, please go to the Baltimore County Health Department's webpage or call 410-88-REACH. That's 410-88-REACH. The number is on your screen now. Next on the show, we're going to learn all about being a police cadet in Baltimore County.